Veterans have put their lives on the line for our behalf, and so we owe it to them to provide them with supports that they need when they come home.
If I wouldn't have learned the skills to be able to share my story, I wouldn't be in the position that I'm in today. I would still be really struggling with the issues that I brought back with me.
My family would tell me how I screamed in my sleep.
When I was in that moment, when I was thinking about what I could do instead of live, there was this really compassionate voice on the other end saying, but there are so many things you could do if you do live.
Well, the Veterans Crisis Line has helped, to date, nearly 1.5 million people. About 2/3 of the people who need mental health treatment don't get it in our country, and most of them don't get it because the system is not set up to be there for them. MHA creates programs such as hotlines and online crisis chat, text, that actually are with people when, where, and how they need services.
Stories We Carry is about finding my way home. I have been trying to find my way home for 45 years.
War is just not the experience of soldiers. War is on all of our shoulders collectively. And I think what makes Stories We Carry unique is that there is no other organization in this country that has the explicit purpose of bringing veterans and civilians into community to transfer that weight, to transfer the burden of war back onto our shoulders.
It's not just vets talking to vets. It's about civilians entering the conversation that sometimes is difficult for them to enter. And I think that that's really because of the misunderstanding of the burden of war and the responsibility that we all have.
And it was so good for me that I kept going and became involved in it. I think it goes without saying that people who put their lives on the line so that the rest of us here at home can stay free, those services need to be provided at the community level. So I think it's incumbent on communities to understand when veterans return to their communities and do everything they can to assimilate them back into civilian life. I think the MHA's network, with the services they already provide for veterans, is critically important.
And that is why it's our obligation to support veterans when they come home and provide them with every resource that they need so they can successfully transition to civilian life.